In the United States of America, millions of low-income families still have trouble securing affordable health care. There are 73 million children under the age of 18 years old in the United States. 20.3 million do not have access to medical care. 45,000 children died every year due to circumstances related to the lack of health care. There's a total of 47.5 million low-income families in the United States, and there are parents that stay home to take care of their sick children and lose almost 3 million working days each year nationwide. 1 in 4 children in the United States did not have access to essential health care. Lack of health insurance is associated with as many as 44,789 deaths in the United States in 2013, more than those caused by kidney disease. In 2016, there were 27.5 million non-elderly uninsured in the United States. The breakdown of the uninsured is as follows. 78% were U.S. citizens and 22% were non-citizens. Non-Hispanic whites made up 44% of the total uninsured, and people of color made up 42% of the total uninsured. The top reasons for being uninsured were 45% of the people said the cost is too high, 23% said they lost their job, 12% said they lost Medicaid, 10% said employer doesn't offer insurance, 9% say family status changed, and 2% say no need for insurance. Geographically, individuals living in the South and southwestern parts of the United States of America are most likely to be uninsured. These states have less robust economies, and 8 out of 12 states with the highest uninsured rates in 2016 were in the South. The financial barrier is the most significant problem that affects families below the poverty level. They're at the highest risk of being uninsured. An example is a family of 4 earning less than $23,000 annually. 8 in 10 of the uninsured families had incomes below 400% of the poverty level. There is a geographical barrier to children being able to receive health care. Citizens with low income live in financially depressed or remote rural areas that have a shortage of healthcare facilities and healthcare professionals, such as doctors and skilled nurses, to provide medical care. Another important barrier that is associated with low-income families is that they are challenged by informational barriers. This refers to the problem of illiteracy. The parents may have limited knowledge of the English language. As a result, it's difficult for them to understand the issues related to healthcare access, coverage, and eligibility. The solution to solving the problem of the lack of affordable healthcare is complex. It requires government involvement to make policies to provide this need. Improvements are needed to existing government-funded healthcare programs such as Medicaid, Affordable Care Act, and Children's Health Insurance Program. Medicaid reimbursement rates needs to improve so that doctors can see children from low-income families. Doctors needs to be fairly compensated for the services. Solving the problem of unaffordable health insurance requires creating insurance plans that increase the insurance pool with younger and healthier members, so to offset the older and more sickly members. Healthcare is a hot political issue that the Democratic and Republican parties have difficulties seeing common ground due to their polarized ideals and beliefs. Thus, with each new administration, there is a shifting of government policies relating to children's healthcare coverage. The Children's Health Insurance Program is a 2-year block grant that needs to be voted on by Congress before its 2-year funding period expires in order to continue future funding for the program. We must eliminate the uncertainty associated with the politics of continuing this program by extending the funding for 4 years. Another solution is to develop and implement a single-payer healthcare system similar to the one in Canada. This type of system would cover everyone, all children and all adults. A single-payer plan would be the only plan and would be accepted by all healthcare providers. Such a plan would resolve the barriers of the current system. The number of uninsured children aged 18 and younger grew by 710,000 to a total of 9.4 million in 2006, and it dropped in 2018 to 3,277,000. due to enrollment in Medicaid and CHIP. Government-funded healthcare programs such as Medicaid, Affordable Care Act, and Children's Health Insurance Program needs improvement. Medicaid reimbursement rates are too low. Current reimbursement rates for medical services makes it financially prohibitive for doctors and medical providers to accept patients with government-funded health insurance. Unfortunately, when children from low-income families do not have insurance, they have few options for care. If they get sick, they may have to resort to hospital emergency rooms for care. Usually their condition has become more acute, requiring comprehensive medical intervention. Implementing a single-payer system in the United States involves the following challenges. 1. Lack of national agreement on what the healthcare program should provide. 2. The Affordable Care Act must provide a solid foundation for the healthcare system. 3. Resistance to a single-payer system that brings cost and care under a single authority. Millions of children still have trouble getting affordable healthcare in the United States, despite the existence of government-funded healthcare programs for low-income families. The following barriers, financial, geographical, and informational, makes it difficult to access healthcare services. It's difficult to make changes in healthcare policy because the federal government must pass laws to make improvements to the current healthcare system. As individuals, we have the responsibility to elect people into Congress that can write and pass laws to improve the healthcare system.